is, of course, extremely common, and it's a big problem in Trinidad. And where I work in a St. Helena village, very often women especially come to me with this problem. Now, the first question I'm always asked is, why don't we talk about domestic violence against men? The simple reason is not a big problem as it is against women and girls. So they're very, very common in women and girls. So women and children are often in great danger in the place where they should be safest within the family. For many, home is where they face a regime of terror and violence at the hands of somebody close to them, somebody they should be able to trust. It is very, very common, and we'll get statistics later on to show how common it is. And the United Nations declared in 1993, they give the definition of it. Any act of gender-based violence, it's physical, sexual, but they also include the word psychological harm. And when we do this cycle of sexual, well, not sex, cycle of physical and sexual violence, you will see where the psychological part fits into it. And that's the definition given there by the United Nations Declaration. And this is the average amount of women who suffer from it, 1 in 4. But of course, in many countries, it's 1 in 3. Now, medical doctors, what is their problem with this thing? Because when a case of domestic violence comes to you, you tend firstly to be concerned with the injury, the wound or the bruise or whatever. And too often we don't take a good enough history to hear the story behind the wound. Very often when they start to tell us the story, we tend to dismiss that and we go and treat what we were trained to treat, the bruise or the cut. But that is not correct. Especially it is totally wrong if you're a primary care physician. Because primary care physicians are supposed to hear this story. When you hear this story, you would realize that probably the woman is more mentally hurt, emotionally hurt than physically hurt. And you cannot just look after the bruise and forget the emotional and the mental hurt that is being experienced. You cannot forget that. And you're a primary care physician, you're supposed to deal also with emotional and mental health. If you ignore that and you ignore that main part of the problem, one of the main parts of the problem, this woman will keep coming back to you, and all you'll be treating is a physical injury, and you are doing nothing to help the situation. You are basically aggravating the situation by not addressing the emotional and the mental hurt. Now, this is a chart showing they categorize the woman pre-birth, the girls and women. Even before birth, you have girls who are expecting a female child. They sometimes seek abortion because they don't want a female child. They prefer male, especially in countries where when you have a female child as if it's a liability, there is something you have to give dowry and all that, and is a problem. So the families prefer to have male children who would carry on the thing. And sometimes when they have female fetuses, they get, even in India, there is a caravan that is going around in some parts of India doing ultrasounds on pregnant women. And if it is a female fetus, they abort in the caravan. And that is, of course, wrong. And it is selective abortion and it is wrong. Pre-birth. Always remember that domestic violence not only hurts the woman or the girl, but it hurts the children who may be looking on. And the hurt on the woman, as we said, is physical, mental, emotional, and so on. Psychological hurt. You could have infancy, female infanticide, and physical, sexual, and psychological abuse of girl children. It's quite common. And then you get into girlhood, the third category there. Where in the world we have child marriages, and in some countries in Africa and so on, they do female genital mutilation, FGM, where they cut out a large part of the vulva area, and they believe that is a cultural practice that is good for the woman. The reason why they say it is good, as they were interviewing, I heard an interview once where they interviewed a lady who practiced it, and she said she don't see any problem with it because she had it. She does this FGM for the village, and she says she is seeing no problem with it when the reporter was talking to her. Because when you do that, you remove from the girl all sexual urges and so on. And because the only reason a girl is there is to have children, no other reason. And she said she had it and she's pleased with it and she will continue to do it, which is that whole thing is stupid. And of course, there's incest and there's child prostitution and pornography that target girls. So women are particularly affected. And here it is, the woman is being affected, physically hurt probably. The girl is hiding her eyes, but although she doesn't want to see, she's experiencing this abuse. And the boy is holding on to his mother. Adulthood. And we have dating and even during courtship, girls can experience violence at the hands of men. And there's a very troubling statistics which shows that girls who have experienced their father beating their mother or domestic violence in their own homes growing up, those girl children who have experienced or witnessed this, they are 300 times more likely to get married to somebody who is also violent. That's a strange statistic, but it is true. Because these girls, violent men and aggressive men, probably remind them of their father, I don't know. But they get attracted to these men. And then the violence continues. This is the cycle you have to know. And this is the domestic violence cycle. In the black outside circle, the violence has occurred, either physical or sexual. But it starts from the center, where the man always wants power and control. That's all he wants, power and control. And if we go to we're doing now the middle, just outside the center circle, power and control. From here, it goes to here, to the violence. But in here, in between, you have the psychological abuse, where there's a lot of emotional damage and mental damage. And different type of psychological abuse. You can intimidate the woman. You can emotionally abuse her. Use violence not on her, but you can throw dishes around the house and pelt food and so on. And you can use the children, but you're always denying it, and the man is always denying it and blaming others. Using children to talk to the woman, and the children gets hurt by this. The man would say, tell your mother so and so, and the mother would also use the child to talk to the father. They can't speak directly to each other. And that is called the process of using children is called triangulation, where the child is part of a triangle, one point being the father, one point the mother, and one point is the child. The child is triangulated in the relationship. And then we have, you can deny privilege, and you can be using this coercion and threats and so on. That is the types of psychological abuse. And the first part of the cycle, that the black circle in the end, that's the cycle you have to really know, is that he says, always says he wouldn't do it again. That's the second part. He always says that. And then you have violence against even elderly women. Because if their husband die and the woman stays in the household, quite often, too often than we would like to, for it to happen, the elderly woman is being abused by either her children or her daughter-in-law or whoever. And there is for instance, in India, there's a village with only elderly women. And once a reporter was asking one of the women why they don't go back home, they said, no, I am better off in this village. Because here, all the women, their husbands have died and they come together to help each other. If they stay home, they would be abused and so on. Elderly women, forcing them to commit suicide and so on. Why these things happen? Well, we mentioned a few countries, and there's a lot of cultural reasons about the appropriate sex role a woman places in the home. She has to stay quiet, do the chores, and do all the work, and the man just bring the money and drop it. And the woman had to continue to work and look after the children. That's a cultural kind of norm. And when that is broken, the man will get angry. And he has to rule, he's the boss. Belief in the inherent superiorities of males. Wow. Males are not inherently superior, far from it. And there are a lot of values that give men priority over women and girls. For instance, when you seek employment, a lot of workplaces would prefer to employ men. And the reason for that is they don't have to take maternity leave. We must always support women who are the victims, encourage them to continue, and we must never, never be silent about it. Cultural reason, the reasons for domestic violence. The notion of the family as a private, you leave that alone under male control. Private sphere, so a lot of neighbors don't get involved with it. They say that's their business. I get into the private matter. And even when the woman reports to the police often has the same thing. Hey, leave the family alone, yes? Let us deal with their own problem. And of course, we mentioned already the dowry, where the family that has the girl child, actually have to pay a price if that girl is going into another family. That family has to pay the other family to take her. That used to go on in Trinidad too. And acceptability of violence as a mean to resolve conflict. Well, in this country, violence is too often accepted to resolve conflicts. When these Trinidad males get into relationships, they just continue. It is very distressing. The hurt is very, very deep. Other reasons why we have domestic violence. Well, we said already that women are prefer to be employed by workers, by places because of they don't get maternity leave. And of course, when you inheritance, they tend to give everything to the boy child. Limited access to education and training for women in a lot of countries. This is a cycle you must know. This is that black circle that was going around the other slide. Violence, sexual, and abuse. We start with the action on the right. That's where the violent act, either sexual or physical, occurred. After that, the second phase is this remorse. The man always saying, oh gosh, I'm sorry, I didn't really mean it, and thing. Oh gosh, you just get me vexed and thing. It won't happen again. All right, all right. And no, but it was a little thing, it's just a bruise you get in your forehead. All right, doctor look after it. And then, but the woman still avoiding him. After the explosion, after the remorse phase, the woman is still trying to avoid him. And he starts to run after her as the pursuit phase. This is going on in the marriage. I promise I would never do this again. Hey, you, why you stop talking to me? Come on, man, I was dead without you, you know. I helpless, I can't do nothing without you, girl. What happened? Hey, you are going to kill myself, threatening and this and that. So he started to run her around the house and pursue her. And then the woman gives in. And this cycle is repeated over and over and over again in households that experience domestic violence. And then we have the honeymoon phase where the woman gives in and she enters into an enmeshed relationship with him. Even she denies the previous difficulty. And even in her head, she could say, well, you know, he grew up in a house where his father was violent. So I had to understand that and take it what I could do. And it wasn't a bad lash and so on. She's trying to justify it. And the relationship is one of enmeshment where she enmeshes herself, she loses herself in the other person. You never must have an enmeshed relationship with your girlfriend or your boyfriend. You don't lose yourself in the other person. Your relationship must never be, you must never be lost in that relationship. You must always remain who you are and allow that person to remain who they are. You are just close together. You are never enmeshed. But of course, the man is violent and there would be a build-up phase where things start to happen again. After the honeymoon phase, things start to build up and there's increasing tension. And he starts quarreling, not hitting now. He starts quarreling, hey, you didn't give the children enough food and this and that, and what happened? Why you cook this thing it isn't good, and so on and so on, and why you don't sweep more often the house and this and that and so on. So build up phase. And then that will go on for a while where he's quarreling about every little thing around the house. And then after a while, he will say, look, I want to hit you again and thing. We are getting into that, but you're getting me vexed. So from now on, this is what you have to do. You have to send the children to school here, and then you cook this so, and you have to do that so. And in other words, he is now controlling. And he instilled fear into her. You better do all these things, but you don't want that to happen again. What happened the other day? So that is called the standover phase. But of course, it's only a matter before another explosion, another physical or sexual abuse, and that might be worse than the one that went before. Reasons for domestic violence, there are legal reasons, and you can read that. The last one is the insensitive treatment of women and girls by police and judiciary. We had something in the recently in the papers about that. I think it was today's paper. Political reasons. So when you have like Trump, a all male cabinet and so on, you're in trouble. Politics can be a reason for domestic violence. And this is the one we were talking about again. You could see it more clearly here, the psychological abuse, intimidation, emotional abuse. Isolation is when the man sometimes can disappear for days and she don't know where he gone. That is a type of psychological abuse. That happens often, you know. She just don't know where he is and he not answering his phone. That is abuse. Always denying it, using this is the triangulation, removing privilege, and of course, controlling her money. Give her a certain amount of money and you can't go and spend more than that. All that is psychological abuse. Threatening, intimidating. And of course, power and control is what drives everything. The man wants power and he wants control. And he can use all this to get that. But if it ain't working, it just goes straight into the actual harm, physical or sexual harm. This is the cycle of violence. The phases we talked about was for outside here. But of course, you have to know what is inside too. And here it is, simple. Same thing. Outcome, well, you could imagine unwanted pregnancy, gynecological problem, injuries. Outcome, PID, pelvic inflammatory disease, headaches, disabilities, asthma is aggravated, and all the illnesses that has a kind of mental aspect to them get worse. We did that. Of course, that's physical outcome. We're dealing with outcomes here. There's a lot of mental outcome, as you would imagine. Right now, and of course, the outcome can be fatal. A lot of suicides, huh? When you hear about it and you're not too sure why the woman killed herself, of course, it's something most likely domestic. The majority of homicides among women is from men in the household. What does it cost our society? Well, I've certainly seen a high cost medically. They always by the doctor, by the police, harassing the police. And the police sometimes dismiss it and saying that it's private matter and leave them alone. Housing and social services if the woman is in trouble. And violence against women gets worse during pregnancy. Strange, but it's true. And the outcome, a lot of the women abuse drugs because that is the only way they could forget their problem. Right now, I have a case where the woman has become an alcoholic and her abuse has increased because the man believe he now have an excuse. She always drinking rum. But I know the girl well from even before she was married. She doesn't even have a history of alcoholism in her family. But the man drinks a lot and leaves the bottles at home. And when he's getting on and beating her and so on, she just used it to forget her problem. And she has now become an alcoholic. And all this happens, of course. You can read that through multiplier effects. The problem is the man hitting the woman, yes, that's the problem. And she's clinging on to him. But the problem here is also him. Eh? Leave that to them. That's a private business. Don't get into that. Eh? And people like this, they are really causing the problem to be worse because they're not reporting, they're not helping. And doctors who remain like this too. A lot of doctors like that. When she gets she last, well, when she started bleeding, think she will come to me now. And remaining outside of it. Doctors are aggravating the problem, not contributing to the solution. Intergenerational transmission of violence. I told you about girls who have experienced violence from the father against their mother. 300 times more likely to marry a boy who is violent. Wow. And therefore it goes on and on. And boys, of course, who have seen their father abusing their mother, those boys would also abuse, most likely abuse their wives. Social multiplier effect. Manuel, come. What is this? Yeah.
You finish?
What is that?
No, that's when you're done. You press that
No, I have
button.
finished.
Oh, okay, yeah. Mm-hmm.
That's seen it.
What do you mean?
It's going on. I'm not.
Yeah, yeah, it's still sharing. Yeah.
All
Go
right.
ahead. Yeah.
No.
Hold on.
Why it not going on?
This one. Try it again.
So we have 10 domestic violence, and she only got flowers one time when the domestic violence ends. What? How you advise women? What do you tell them to do? What is my advice in the office when I'm aware of it? Advise the victims: do not accept the violence. You show them. I teach them about the cycle of violence so they can identify it and know what is happening each time. And they have to get a good self-esteem because the prolonged violence decreases the self-esteem. And they say, well, if especially if they're not as educated and so on as a man, they believe they are a lesser creature. But as a doctor, you have to improve their self-esteem because no one deserves this violence. I always tell them to recognize psychological abuse so they can try to stop it at that point. And also, they should be educating their partner when they're in better speaking terms about the cycle and so on. They can go on the internet and search for their cycle and speak to the children. The women have to speak to their children, explaining their predicament. And if nothing is helping, if the man cannot listen, cannot resolve it, run. It's difficult to change the man. You cannot change the man. Very hard. Escape, plan secretly, secure your money, report to the police, secure your children, and so on. But always confide in your doctor. And you always advise them to see if they could get out of it because it might lead to their death. Now we'll go and do intimate partner violence, which is the other name given to domestic violence. So hold on a bit. Let's switch to the other slides. Right.
Yeah, hold on. Just share the screen. Right, actually,
Right. Everybody is seeing that intimate partner violence. Hey, you've seen it or you're not seen it?
Hi,
Nobody.
yes, I can.
Right. Everybody's seeing it. Right. Intimate partner violence, IPV. This is the new name given to domestic violence. And this is the definition. A threatened or actual use of physical or sexual force or psychological emotional abuse against a partner, which results in death, injury, or harm. Any violence between partners, all adults, intimate relationship, same sex or whatever. One of the most common form of violence against women. And the overwhelming burden of partner violence is borne by women, as we said. That from the this slide is from the WHO, World Health Organization. And we said all that already. This new slide, this new PowerPoint is giving you a better idea of statistics. 48 populations was studied, and they imagine up to 70% of women reported being physically assaulted. Wow. So the average age range is about 30 to 40% of women. And most of them is multiple acts over the years. and a significant amount of deaths among women caused by men, 40 to 70% of the female population. No, this one saying that a range of countries show that up to 70% of the female murder victims were killed by their husbands, but 30 to 40% experience violence, IPV, intimate partner violence. So let's look at some of the statistics. But one thing to remember in a study that was done in the States, there's a correlation between child abuse and intimate partner violence. So probably in the same home you can have child abuse going on. And of course, therefore, when these you have to make notes, your notes carefully as a doctor, because when the children of this relationship come, you always have to be sensitive that the injuries they probably come with was not inflicted at the home by somebody who owned the home. Children have trouble in from that home, and of course, school retardation. And the boy children can be quite aggressive. This is something you have to know about, a term called toxic stress. This is when you have a stressful situation and you don't know how to get rid of it. So the women in these households have toxic stress, and the children, of course, have the same. Chronic stress, unpredictable, you don't know when the next explosion will occur. Uncontrollable exposure to adverse conditions, and they have no access to anything to buffer, and they're just trapped. Toxic stress. It's a term you should know. Toxic stress is a new term, really, and it certainly applies to domestic violence or IPV. Right, so here we have the statistics. One in four, one in three, when controlled for unemployment and poverty. World situation. That's the old world. And they did a study in Canada, for instance. 30% of the women, IPV. The bigger the study, the closer you will get to the actual number. So they have a big study in 12,000 people, 12,300 in Canada. So when they get closer to the 30%, 8,000 in Nicaragua, they get closer to the 30%. So that's more accurate. Remember that it crosses all cultural all boundaries, educational boundaries. Sometimes the more educated the man is, the more stupid he is. And he's violent and he gets hubris, excessive arrogance. And he wants his wife under his control, especially if she's not as educated as he is. Religion, it crosses all religion, employment status, so on. We did some of these consequences. We did that already. It's important to know with the children, if we can talk a little bit, the boys become aggressive and abusive. Adults in their home, but they become aggressive in their social relationships. So much of our murders in Trinidad are committed by men. And the boys growing up in homes, probably you wonder what the situation went on in the homes. The girls are 300 times, like, as we said already. People who are abused as children are 18 times more likely to commit suicide. This is a serious problem in this society. And as doctors, we certainly cannot just pass it by and treat the physical injury alone. Because especially as family doctors, all members of that family would be coming. So I have so many cases in my office. But you see, there could be another doctor in I work in St. Helena Village. There could be another doctor in St. Helena Village who's saying he or she doesn't see any cases. He don't know what Dr. Sinrai talking about. But you see, if the patient doesn't have a good relationship with you, they would not divulge the information. They wouldn't tell you how the injury happened. But with me, I think we have good relationships. I have good relationships with my patients. And the woman often disclose it to me. They tell me. And so therefore, depending on the quality of the doctor-patient relationships, the doctor would be more aware of it. And then because you are now the family doctor, so even the man who is doing the abuse is coming to you. So you have to talk to him maybe with his wife present. And when the children come to you, as we said before, you have to look out for the reasons why they're coming with frequent injuries because more child abuse occurs in these families. And you have to look out for their, find out about their schooling and their own aggression and their own progress in life because it could affect them. As we said, it is wrong to believe that these wrong beliefs. A man has a right to assert power over a woman. What? And he's socially superior. That is totally wrong. A man is socially superior. A man has a right to physically discipline a woman for incorrect behavior. Well, yes, that couldn't be more stupid. And I like this one. Physical violence is an acceptable way to resolve conflict. That is in more ignorant. I like this one. A wrong belief. Sexual intercourse is a man's right in marriage. Well, yes. A woman should tolerate violence in order to keep her family together. Well, a lot of them tell me that. And especially when the woman is not working and the money is coming from the man and she has to support her family. There are times when a woman deserves to be beaten. Now, that is so wrong. I remember when I was working in the department, a student, we send students by doctors, and a student came after a class, said, Dr. Sinoyan, I want to talk to you. I said, what happened? It was a female student. She said, I was in this doctor's office and he teaches here too. I said, okay. I said, what happened? This is many years ago. She said, while we were in the office, the woman came in and she was the victim of sexual abuse. Not sexual, physical abuse. So she had this cut in her hand and so on and bruises. And he heard the story. The doctor heard the story, looked after the wound and gave her correct medicine and so on. But he never addressed the issue of the violence. He never spoke about it. He didn't carry on that conversation. And I said, so what happened after? The, the female student looked at me and she said, Dr. Ryan, when the when the patient left, the doctor looked at me and said, you have to know that there are times when a woman deserves to be beaten. He used those same words. She said she was so appalled. She didn't know what to say. So she come and she tell me about it. Well, I was similarly appalled and horrified. But I let the doctor know what I think and let him have it when I saw him next. Because that is certainly wrong. I like sexual activity is a mark of masculinity. Well, yes. Girls are responsible for controlling a man's sexual desires. Yeah, right. So the girl had to cover, she could, the man could walk around naked. Is that right? All those are wrong beliefs. A lot of people say that, especially the neighbors. If she didn't like it, she wouldn't stay there. And that is a Trinidad expression. If she didn't like it, she wouldn't stay there. And women want to be raped. Well, yes. And why did you leave? The last one there. A lot of people ask that. Are we part of the problem? Doctors can be part of the problem. You have to be careful because you are in a good position to be part of a solution, not a problem. And educate the woman. Always ask. Right, I think that's it. So here what we're doing, we're going to take a 15 minutes break and I'm going to see you all at, you hear me? At 20 minutes past 10, is that correct? We meet again at 20 past 10, okay? Are
Sure,
you
no
hearing?
problem.
And then we will have two lectures, one on health illness and the other one on issues in the elderly. If you have any questions, you can call me at 669-4720. Write that down, 669-4720. You can actually call me anytime in the office. That's my office number. And we can talk over the phone. And if you want to spend some time in my office, of course, call me and we can make an arrangement for you to come and sit with me a while and so on. We're meeting at 20 past 10, and please wear your mask when you come. You have to wear a mask. I don't want to catch anything. See you. Manuel, we're taking a break. Manuel. Hello, we back? Hello? Not hearing me?
Hi, yeah, we are hearing you.
Right, everybody's there or what?
Yeah.
Okay, right. So we going to do a section here now, PowerPoint that called health, illness, sickness. The definition of these things, health behavior and health beliefs. You have to be careful with this PowerPoint presentation because there are a lot of different definitions we are doing. So you must go over your PowerPoint carefully even when the lecture is finished so that you understand fully what went on. This is the definition of health by WHO, a complete state of physical, mental, and social well-being. Like nobody healthy in this world. And that's because of the word complete. A lot of people say they shouldn't use complete, but the definition is enduring and is continued till today. What is the meaning of a complete physical, mental, and social well-being? And not just the absence of a disease. There's an old definition of health. But you know what they have done now? With this definition, what WHO have done with it is they have the word complete, but they put physical, mental, social, and spiritual. They've added the word spiritual well-being. They've realized that we are also spiritual beings. So we have physical part of us, mental part, social part of it, and a spiritual part. All that comes into the definition of health. And of course, as this slide shows, it is since 1946, it is a definition. It's the most enduring definition we have, but complete is a difficult word. And they have added social health. And I mean spiritual health. No, we did the definition of health. What causes people to get sick and dead? This is a good, interesting chart. So social circumstance, if you live in an area with a lot of violence and so on, it contributes an average of 15% of deaths, premature deaths. Exposure to things in the environment, Sahara dust, the type of healthcare you have access to. If you live in a country with poor healthcare, it can lead to premature death, and that can contribute 10% of the overall premature deaths. People dying before they expected death. But the biggest contribution, which is 40% here, and this is something you have to know, take away from this slide, the behavior of the patient. If the patient behavior weird, well, they will continue to be sick no matter what country they're in or how clean the air they're breathing and so on, whatever. Best hospital in the world, but if their behavior is wrong, they can die prematurely. For instance, if they're involved in violent activities and so on and so on. And 30% is the genes you have inherited. So what I advise my patients to get all the genes and wash it out, so it wouldn't have any kind of problem. Genetic predisposition, you inherit cardiac disease, high blood pressure, and so on. We could put that in a kind of circle, 3 interlocking circles. These circles interlock, social and physical environment interlock with behavior of patients on the left, and the one below it interlock with the medical practice, because the reason of interlocking is that one can determine the other. This is easy to understand. But the important thing to realize also is that these 3 interlocking circles, it's at the background of the genotype that you see written there. Everything is in that background. Your genes, crucially important. Now always remember that health is not the object for living. It is always a resource to live. Too many people, especially when they get elderly, they're only concerned about their health, their health, their health, their health. You're not living so that you could be healthy. That's not the reason for living. You are healthy so that you can live and do other things. Biggest trouble in the whole wide world, cigarette. While with thin and tobacco making millions of dollars, and the government getting good taxes from it, it is killing our citizens. Cigarette smoking is trouble. Okay, now if we can separate all these genes and social circumstance and behavior and try to just list the determinants of health, what cause people to be healthy? And you will find an interesting 12 list, a list of 12 things. Your income, how much money you're getting, and your social status in society. So people who have a high social status tend to be healthier. High income, healthier. Social support network, lots of people to support you, you live better, enjoy better health. These are the determinants of health. More educated and more you can read and write, you tend to be healthier. Whether or not you're working, the social environment and your physical environment. As the first six, and the other six is this. Your personal practices, of course. How healthy you developed as a child, that depended on your parents and so on. Your genetics, of course. The healthcare service you have access to, your gender and your culture. Nearly everything here, from going back to this one, the first six, nearly everything there is determined by how much money you have, And this one, your gender is not determined by your money. Culture, probably not. But everything is how much money people have. Money is a big determinant of health. So people who are in a poverty, they're in what is called a poverty trap, as we said, as we mentioned earlier. What health service you have access to? So this morning, just this morning at 8 o'clock, a lady brought to me a big document that she went to a place somewhere in Dabadi, and she did a series of tests, and she brought it to show me. It was total rubbish. One set of tests on this and that, and nothing made sense. Nothing made sense scientifically or biologically. She paid the people a set of money for the results, and she bring this document for me to read. Total, absolute rubbish. I wrote with a red pen over it, and I put my stamp and I sign it, and I say, go and drop this back for the people who take all your money. A lot of people are doing stupidness to get money from people. Features of being healthy. Health behavior. That's what we're doing that. Any action undertaken to promote your health. Now you can health behavior if you can have access to the public health care service, which is scientific Western biomedicine, or you try Nobia and so on. That's your health behavior. And of course, your behavior to maintain your health is influenced by your beliefs and your culture and your so on. Economic issues. So we have sectors that give people maintain their health to keep them healthy. The folk sector, more in use long, long ago. But now we have the public sector, medications, and then we have the public sector is like the pharmacy where you ask your neighbor what medicine they're using, and you go in the pharmacy and you talk to the pharmacist and so on. The normal medicines like Panadol and things. But the medical sector is when you actually face the doctor. So there are three sectors people have access to. when you're sick. 3, and they have some interlock there too. Alternate medicine, that is the fringe medicine, the alternate medicine, complementary medicine, different thing, words different. But we're not practicing that. We practice Western scientific biomedicine. With your MBBS degree, that's what you are trained in. So don't get into this thing. But of course, a lot of people don't like the kind of the way they are treated in our traditional healthcare systems, and they resort to the other things. And these people might treat you better, might have a better regard for you, or they might treat you with more respect. And that is why doctors have to be very careful how you treat people, because you have to keep them within the proper sector to get better. A lot of this alternate medicine increasing, instead of decreasing. A lot of people getting into it. When you want to change your behavior from if you want to change somebody's behavior, the person have to realize they're susceptible, that the problem gets severe. Like let's say they're going to an OBMan and not getting better. But then they realize they're susceptible to early death because their parents died early. And they understand this is a severe problem they have because they're really, the headache not passing. And a lot of people went by the medical doctor and they get benefits, so they can perceive benefits there. But the barriers might be the medical doctor charging too much, or they don't like the person. So all these things come into play to make them change the behavior from A to B. Now, health, we did the definition of health. What is illness? The definition of illness, somebody come to you, when they come to you as a patient, they come to you with an illness. An illness is a symptom complex. And all the symptoms put together. So that's the illness. Public sector, pharmacies. How you go from beliefs to behavior. All this depends on what you do with your illness complex. This is what you should know. When you have something wrong with you, this is stages of illness experience, 5 stages. Stage 1, something wrong, I have this bad headache. Let me go and get some medicine and take it and drink some bush or something. But then you could deny you have the headache and forget about it. Or you take the thing and it didn't work and you say, well, look, I really have a headache, let me try something else. The second stage of illness behavior, I really sick, yes. So let me go and get a sick leave. I can't go and walk, the work causes. So you request a little leave from the place where you're working. And you start to sleep more or whatever, or take more of the medicines. But then you could deny it, of course, and go back. But you're still sick. That headache is persistent. So I better go by and make a formal, I go and talk to the doctor. So the doctor just went for a sick leave to get a legal document saying that I'm sick. So the doctor gave it. So you had a medical contact, but you just talk to him. Tell him you'll come for no examination. But I have this headache, and he tell you to take some Panadol and thing. But then you're not getting better. You're trying a few other things. You're shopping around. And then you realize this headache is passing. Let me really go and see a real doctor and let him sit down and check me out. So I'm going to get professional treatment, stage 4. And the doctor give you headache, which is migraine. You could reject you could always reject his diagnosis or her diagnosis and say, me a studying that doctor now. Or you could take the medicine and you accept you're sick. And then you could go back, relinquish your sick role, and assume your normal duties and so on. So these are the stages of Sean, health psychologist, wrote this, formed this 5-stage for us. Stages of illness experienced by a patient. And before you go from one stage to the other, as we said, you can contemplate whether you're doing it, so on. And what would make you change is your perceived severity, perceived susceptibility, and so on. Same thing, same thing. Exercise, tips to reduce weight. All of you can try this out. And you would lose weight. Now, before you change from one to the other, you pre-contemplate, you contemplate. From one stage of illness behavior to our next stage, you go through this. Now, sickness. We did health definition, we did illness definition. What is sickness definition? Parsons, the psychologist, has defined for us at all time what is a sick role. The patient sick with something, they're ill, they have a symptom complex. The patient needs relief from normal duties, and they will heed medical advice during the illness, and they really want to get better. So once these 4 things are fulfilled, you can give somebody a sick leave. Give somebody a sick leave, you don't really have to make a detailed diagnosis on. That is, when we did the Schwann stages of illness, the doctor did give the person a sick leave without examining them, because they needed a legal thing, a legal sick leave. And that's a doctor can give a sick role and just talk to the patient about using some medicine to get better. Once you fulfill all these, but the patient have to want to get better, but they want a little relief from their normal duties. So don't make a big issue about giving sick leave. You can give sick leave. But they have said doctors alone could give it. I don't know why. We give sick leaves. Sick leave to put the patient into a sick role. Is there always a relation? The boss that they get the sick leave, the boss don't really have to take on the sick leave, you know. Sick leave is worded, I would recommend. The boss don't have to heed the recommendation. It's just your suggestion. And somehow they have given us this capacity to do it. The sick leave don't have to state any disease. You could just state the symptom. Belly pain or whatever. So those of you still trying to get in, or if you try the first thing I said about turning your head and closing your jaw and it didn't work, you could try that in the morning. The sick leave is not a legal document, and it cannot bind the doctor, because it's what the patient tells you. And it is not a binding legal document, because even if somebody comes for a sick leave and they tell you the name, you don't ask them to show them your ID card to make sure that is the name. You just accept what the patient telling you is true. That is a strange situation with a doctor. A doctor has to accept that what the patient is telling them is the truth. That is weird, but that's where we are as doctors. We cannot believe everybody is lying to us. We have to believe everybody is telling us the truth. Now he can follow the advice about shaking the head and so on. This is what I just said. And this is the big trouble in the world. And this is the next big trouble. All right. This is a slide, although I did it quickly. This is something that you have to go through in detail and read it carefully, because there are lots of different definitions and ways to understand it, like going from one stage of Schwann illness behavior to the other, pre-contemplate and so on. And what would make you change is your perceived susceptibility, the perceived illness, how bad it is, and severity of the illness, and so on, and the definitions of these different things. You need to go through the slide carefully and make sure you understand it. We will now go on to issues in the elderly. Manuel. Right, so we'll change this slide to medical issues, elderly, and retirement.
So does it stop this one?
Yeah.
Because there's someone.
That was the last slide, was it? Yeah.
Hold on. This is the last one, right?
Yeah. Elderly.
Oh, I have to wait for it to open. Hold on. Actually, they could see.
Right, are you seeing this? The elderly and retirement?
Yes, I see that.
You're seeing it?
Yes.
Right, good. So we're going to deal with the elderly and retirement. Retirement. Retirement brings a sudden change of life. People over 60, over 65. And this can be very stressful. And during retirement, you can have a faster development of physical and mental problems. The change can also lead to dysfunctional family relationships. And important to know what retirement and just before patients get into retirement, you have to prepare them. But the trouble is, a lot of people, when they're going into retirement, they'll be happy, I'm going to retire, I won't have this to do, I won't have that to do, and so on. Fine. But sure, but when the boat trip and thing come back and they come back home after the cruise, these problems start to accumulate. They have more time to themselves, smoking more, drinking more, staying more with the family, getting into family disputes more often. Like with the COVID, with everybody close together, we have more family disputes. And now with the retirement, the man always home. As a lady tells some about her husband, she said, I married him for better, for worse, but never for lunch. The man home every day, all the time. And it can be very stressful sometimes. So although you think you have an easy time, it is not always so when you retire. And you have to know if you have poor health before retirement, it can get worse after. So just before retirement, you can get a lot of people when they come to you to step up their medical care to make sure they know and they're sure certain what medicine they have to take. If they have insurance while they're working, that'll be very good because then you can send them for the routine blood tests and screens and so on. So you kind of make sure where they are now and how they should be operating from now on when you get the results. So 1 or 2 years before, you stabilize them. Whatever you have to do, blood tests and so on. Dental, don't forget eye and dental examination. Especially if they have the insurance coverage, it'll be easy for them. Always in the elderly, always you have to talk about activities. But the ironic thing is, elderly people do get joint pains or osteoarthritis, and they tend not to move about as much. But you have to get them out of that mindset. You have to take whatever tablet they want for the pain, but keep the body on the move. During the day, they have to keep activities going and get into an exercise routine. People who do gardening very well. That's very, very enjoy good health because they have to keep bending down and looking after the plants and going out and so on. People who do regular exercises. So exercises get more and more important as you get older and older. Strange. They become a little painful too, but you have to take your tablets for your pain and do it. So you talk to them about primary, secondary, and tertiary prevention. We did the definition of that. Primary is when you tell people how to get better and how the context of an illness. Secondary is you do with them in the context of an illness, like check their pressure, looking for hypertension. Tertiary is when they already have an established illness. You do tertiary prevention when you deal with that illness and prevent it from getting worse. Poor health behavior before drug abuse. Discussion about cigarette and alcohol. A lot of people have this problem. They believe when they stop working, they have no problem. And they're unaware of you have to be aware of a condition called the compression of morbidity. What is that? Compression of morbidity is long ago in the 1900s, and then people born and they die around 40, 50 years. Between birth to death, which is say 45, all their illness episode or all their morbidities, morbid events were kind of evenly spaced between birth and death. But as science has advanced and the lifespan of people has increased, so we die now, say 70 to 80. What has happened with the morbid events? A lot of them are now compressed towards the end, compression of morbid events. So if you're a primary care physician, a lot of the elderly come to you because morbid events are compressed towards you. So you always have to be on the lookout for chronic illnesses. Always check them out. And it can start at any time. And be very, very sensitive to it because of compression of morbidity. And you always on the lookout for risk factors, lack of exercise, overweight, poor health care, and so on. And remember, if they retire, they don't have as much money as they do. They cannot afford. A lot of these doctors take great pleasure in giving people extremely expensive medicines when they can get an alternative that is probably cheaper. Money is crucial here. You have to advise the elderly too. That I told you already that you always advise them to keep moving. But they should try, although they have lost their job, you should always tell the elderly, and your parents, you might have to tell this if they're retired, that they have to be productive. They can be productive in new areas. A lot of people have adopted kind of new vocations. So you don't have to stay with one vocation, you can get into another. So in my village, a lot of the elderly men, they become pundits and priests and things. And they start to do prayers for people, and that's okay. They just have another role, another vocation, and that keeps them healthy. Now, the elderly has more chance of themselves, so they're always asking serious questions about life and so on. And they always want, so a lot of people ask about why they're here and what is the reason about all this and so on. So kind of existential question. Existential is dealing with existence. When you're asking existential questions, you're asking questions about why you exist. And of course, everybody have to get into that, asking existential questions. But the elderly now have more time to reflect. And they do ask these questions. And the elderly can become more wise. The definition of wisdom. What is the definition of wisdom? You become wise when you change your behavior depending on your past experience. That's wise people. People who are wise have changed behavior because of past experiences. No, you could have plenty experience and never change your behavior. Well, then you didn't get wisdom. So the elderly have a greater chance to be wise because they've had more years of experience. But there are a lot of elderly people who are not wise because they never changed. And they just age take them from a young fool to an old fool. Don't let that happen. Elderly should get wise. And that is why a lot of countries, for instance, in Africa and so on, the elderly wise are together helping the society. They kind of advise the young people. So when there's any problem in the village, they go to these people. But the elderly can lead very satisfying lives. They can find new hobbies and new vocations. And they have more time to look after their health. And they can enjoy longer periods of good health if they look after themselves. And adopting a new vocation is okay. It's happening all over the world now. And the health system can affect people's health. The last one there is health behavior, vocational change, often related to spiritual awakening. Because when they ask themselves existential question, they can have a spiritual awakening because the spiritual side of it, which is in the definition of health, is awakened, and we kind of seek answers. So the religions of the world do offer answers, and people hold on to it. And these people can become spiritually awake. It doesn't mean that you have to get old to ask spiritual questions. You ask it from now. So you search for answers, existential answers. And a lot of elderly people, when they start reading Bible and so on, a lot of people criticize them and say they're just cramming for the finals. So older men can become pundits and preachers. But their new status of being a pundit or a preacher can lead to satisfaction, richer social network, more people around them, and so on. And they can lead to longer life. So you don't ever discourage spiritual awakening. So low income when you retire is worse when you get, of course. Removal of health insurance is a problem. The problem could worsen. Now your partner. Men whose wives die because both of you getting old together. If you're married and your wife dies before you, they did a large study in the States, and they found out that men or widowers, wives have died. When their wives die, they suffer a sharp decline in health and so on. They die faster. Their wives' death affect them terribly. But the same study with men and with women. And if women suffer the loss of their husbands, what happens to the women after? Women whose husbands have died before them, these women who are left as widows, the strange finding in that study is that these women enjoy a longer and happy life. They're not affected as the men would be. I don't know why, but I have some suggestions. So women are differently affected. No, the women are differently affected because maybe I should give it a suggestion. As men become older, during their life they're working and they're aggressive and they're bringing home the money and this and that and driving the car. And when they get older, they become more nurturing, things they miss out in their life, more want to look after grandchildren and so on, nurturing. But women all their lives have been nurturing. And as women get older, they become more aggressive and they kind of more want to do things how they want us to do it. and look after themselves on, they become more aggressive and self-determining. So probably that's why they enjoy better life when their husband dies. But the men, since they have become more nurturing, they do suffer when their wife dies. So always talk about their lifestyle, because remember they have more time to do stupidness too. Involve engagement in the society. So if they belong to a social club, Kiwanis Club or Rotary or whatever, or a group like the village council, tell them to get involved if they can. Go and make new friends and get involved. Or go and sell in a grocery now, look. Health insurance, if they can continue it, it would be good. This is what I said. Tense, dysfunctional family situation to poor health after retirement. A lot of men, when they retire, the woman seeing them home, and it can create a problem. And with dysfunctional family, I always remember this manager of a big company in Trinidad. He used to come by me when he was still working. He was always in fairly good health. So he never had many visits, but then he suddenly retired. And then his visits to me, he was home all the time. And he started telling me about the problems in the house and this and that. He never get any major chronic disease. But when he came home, he realized two of his sons were in cocaine. They were drug abusers. His wife never told him. So he got that burden to bear and staying home all the time and bearing burdens with his family. And his wife was giving some problems and so on. And one day they brought him to me and they asked me to come out and see him in the car, and he was dead in the back seat of the car. And you have to be so careful when you retire, because it is a different situation you're putting yourself into. And that is why you have to prepare yourself and don't fool yourself into so be all merry when you retire. Now, but you need to be with persons, elderly people in family around. Put them in a, it's not right to put them in an old person home and forget them. They deteriorate faster. Because as this theologian or philosopher said, Paul Tillich, a person is not a person without other persons. So we all need other people to have relationships with other people. We all need to be in a situation with other people. And in this COVID period, we are suffering if we are not interacting with others. Not only our members, but other people in the society. So the more we get involved in social activities after retirement, we keep ourselves healthier and we become more as a person. We become a person. And this is important to know. So don't be like these wise men who go up in a mountain and they're reading the Bible or whatever, and they know everything because they don't talk to nobody. No. When them come down, they're the more stupid than anybody. They have not interacted. You don't isolate yourself. If you want to become a person, you have to interact with others. And of course, involuntary help, retirement is worse. So if you suddenly get laid off, that is affecting you bad. Voluntary retirement is a little better. And you always plan and you help when they come to you in the office during this time, you help them through. And the elderly, you're always concerned with the relationships, new things they have found out about their family and so on, and what is going on home, and who is looking after them. Now, the elderly can get a lot of disability, so you want to make sure that you have somebody at home to help them around the house and so on. And if you have a home that is tense and dysfunctional, Just as how the children would suffer, the elderly in that home would suffer also as the children, because they need support from the others and they're not getting it as they should. As children need support. Mental health. This is a big issue because poor mental health before retirement, you're going to get worse after retirement. So there will be a deterioration. So make sure you stabilize that mental health, whether it is be anxiety or depression or something more serious. You have to stabilize it before retirement. And remember, as we get older, all losses accumulate. So as you get older, you know more dead people than your living people. So you increase your loss and you can get clinically depressed. But the depression, you must address it. If depression was there as something before retirement, it is going to get worse with retirement because of the losses and the things that is happening in the house that you didn't account or you didn't think it would happen to you, and you didn't know that was happening in your household, and you didn't expect so and so to be like that and so on. So depression before retirement can make it worse after retirement when you're in a different situation. So you have to stabilize the depression before, and you might have to increase drugs or add drugs might have to be added to the depression drugs when they get older. And remember, you always tell them that they can get more depressed if they stop keeping their brain, if they're not using their brain as they used to. So if you had a job, for instance, that you were very active and always have to be thinking and moving and so on, and you suddenly use it, your brain can deteriorate and you can get into real problems. Because the brain, as this sentence says, the brain, like any other organ, if it is not used properly, it would deteriorate. So you tell them to read, go to the library, get involved with something, get involved with a group, get involved with books if they can, go to the computer, get involved, use the brain, because they would have more time to do it also. But very often as primary care doctors, there is something called crippledom. That is sick role behavior in the elderly. And that is the elderly, they only talking about health. As if health is their reason for living, not the resource for living. Remember we said that. Health should be a resource for living your life. It should be the reason you're living. And you're talking to elderly people and all they're talking about is they're sick and they're going by the doctor and they have this wrong with them. You have to get them out of that trap. And you have to prevent them from getting crippledom and they always using the sick role. They use it as an excuse sometime and always coming by the doctor for every little thing. And the old, like all of us, elderly, like all of us, we have to know. They thrive better when they're cared for, admired. And the brain, like all organs, works best when it is stimulated. And remember, when the elderly is in the home, you have a chance to use that source of wisdom. And if you're using it, it would help the elderly too, because they will know that they are fulfilling a role in the family. So you always ask them for their advice and on and so on. But of course, the elderly in the home can become demented. And dementia can be progressive, where they're forgetting things and doing stupidness and so on. Well, then you have now to look after them as a mental problem. There are medications for early dementia and so on. And we do use it. And if there is an underlying depression, we would give the depression medicine together, sometimes with the medicine for early dementia. But people who are elderly and getting demented, where you can't depend on their wisdom and so on anymore because they're not thinking straight and they're forgetting and so on. These people need even more care because left alone in danger. Putting down old people's home and forgotten in danger, you're shortening their life. They need people who can care about them, and their family members are in the best position to do it. So this is a challenge to the others in the family. It is a challenge, and they have to accept that challenge, and they have to do it, and they have to look after the elderly properly, mentally, physically, and give to them a home environment that can make their deterioration not so rapid. And you give to them the LOVE that we all need. LOVE. Now, there's primary and secondary aging. What is primary and secondary aging? Primary aging is when you're getting older, a lot of things happen. You lose cells, you lose this and you lose that. That's happening with age. You lose cells in the body in different organs as you get older. Secondary aging is when during your life you have an illness that has been diagnosed. For instance, diabetes. The diabetes now is added to your primary aging, and you have both going on. And it increases the rate of aging, secondary aging. But it's not all bad news. The world is becoming more and more aware of the needs for the elderly, and society is becoming more and more aware of that also. And with the world as it is going now, and the fertility rate of women decreasing, less children in the world, you're getting more elderly. And therefore the world has no choice but to look after the quality of life of the elderly. And the population from 60 to 80 is increasing all over the world. And the people the governments and so on, and people are realizing they need help. So a lot of things are happening that is good to them. And in a study that was done in the States, 2/3 of persons over 75 years of age describe their health as good, very good, and they're satisfied with it. Because they have clubs, they form exercise groups, they go to meetings, they learn about social activities and do new things in their life and so on. That's very good. There's good news about aging, cognitive aging, that's aging the mind. Unless there's dementia, which is the opposite of this. But cognitive aging can cause wisdom and create productivity. And a lot of aesthetic appreciation. A lot of people, when they get older, if they didn't have it before, they learn to appreciate music. And they learn also to appreciate spiritual things and so on. And they pray more often and they read their Bibles and Quran and so on. Spirituality does improve, and that is to be encouraged. And they're not cramming for the finals. It happens to all of us. And all of us should be cramming for our finals. So you don't ignore the spiritual part of yourself. And then there's cognitive aging, there's physical aging. We did first, remember? Physical is primary and secondary physical aging. Then there's cognitive aging, as we just did there, aging of the mind. There's normal cognitive aging, not dementia. If dementia is added to that, you'll have deterioration. But there's also psychosocial aging. People do things differently when they get older. And you notice that as people get older, the individual differences kind of stand out more. So if you go to the mall, you're seeing all these young people dress up the same way. I see a lot of them wearing tear-up clothes now. This tear up and that tear up, and they think it's a good thing to do. I advise all of them to look at the mirror before they leave their house, but they don't take me on. All the young people doing that, all of them dress up more or less the same. If you look at the older people, they dress how they are to be themselves. They dress as an individual. And older adults rate their satisfaction with life higher than any other age group. They can get more satisfaction. And this is because their personality is more secure. And that should happen with psychosocial aging, proper psychosocial aging. And there's more retrospection, as we say. They have more to look after because they have a longer life to look back at and to wonder and concern. They have more time to retrospect about their life. Why did this happen and how that affected my life? And you encourage it because that leaves a spiritual search also. They're searching for life meaning. And the larger the sources at the back, so they have more to look at in the review mirror. So they can plan forward better. And they can get more satisfaction with social life. And as I said, you encourage exercise. Encourage them to keep moving. The muscle and bone make to be used. Psychosocial aging. But of course, it can lead to disengagement. And you have to control that because a lot of elderly people, they have this tendency, they should get them out of it. When I don't want to do that, I don't want to do this, hey, leave me alone, or you take all your children and go home and I get old now. And no, that is called disengagement. The studies have found that that is not good for them, for the elderly. The more engaged they are with what is happening around their house, the better for their health. So you always your parents that when they don't want to look after your children, tell them you could quote me. Tell them Dr. Sirine said that they should look after your children and stop being disengaged because it gives them new self-worth, new interest. And as I said before, older women gets more assertive while men get more nurturing. Meaning of aging. To confront our approaching death cracks us open, shattering the layers of life that accumulated over the years, revealing our inner core and laying bare what really matters about us and what really matters about our life story. So life looking backwards is but understood. Looking forwards, but is better understood by looking backwards. If you have more to look backwards as along, if you're living older, you have more to look backwards, so you have a better understanding when you live forward. So perhaps enlightenment and understanding come only as we see our lives through our review mirror, looking backwards. Right. Keep on the move, whether you have to use a stick or what. Keep that relationship going. Relationship, because a person is not a person without other persons. If your spouse die, you get relationships with other people. And you keep moving. And gardening is something that is excellent for older people. I encourage it. They do their gardening around the house. So they have an extra piece of land. That certainly helps them to live longer and keep that smile on your face. Right, I think that is the end. Thanks for listening. If you have any questions, quickly, if anybody want to ask me anything. Right, you have my phone number, right? 669-4720. And you call. I do not work on a Tuesday and a Thursday and a Sunday. So you call on Monday, Wednesday, Friday or Saturday in the morning. Monday, Friday or Saturday in the morning. My receptionist would answer and just identify yourself as a medical student and you want to talk to me, and she'll put you on to me right away. And I will stop what I am doing and I'll talk to you. And of course, if you want to come and spend some time with me, you are most welcome. The office, my office is there for you. Thanks for listening. Bye.
Thank you, doctor. Take care.
Right, Gail, thanks. Manuel, done. call me. I give them my number if they have any questions.
Okay.
Because when they're reading the book, give them my number in the office.
Look your office phone. Just take it.